Webinar today. Before I begin, I want to let folks know that we're recording the webinar. Just please be aware of that. Welcome to our second webinar in our two-part series, exploring the unique value and strengths, along with the challenges to co-location and co-working models to increase access for survivors. Last week, for folks who were on our call last week, you may know that we took a broader view exploring co-location partnerships within and outside housing systems. And today we're taking a closer look specifically at how the co-location, co-working models between housing and victim service providers and victim service advocates can support survivors' access to housing. My name is Suzanne Marcus, and I'm with the National Alliance for Safe Housing. And I'm joined today by my colleague, Debbie Fox, with the National Network to End Domestic Violence. Jenny, next slide, please. This webinar series is part of our work with the Domestic Violence and Housing Technical Assistance Consortium, which is an unprecedented partnership between the U.S. Department of Health and Human Services, the Department of Justice, the Department of Housing and Urban Development, that brings together the National Alliance for Safe Housing, Collaborative Solutions, National Network to End Domestic Violence, the National Resource Center on Domestic Violence, the National Sexual Violence Resource Center, and the Corporation for Supportive Housing. All of these technical assistance providers are collaborating our efforts at the intersection of domestic violence, sexual assault, homelessness, and housing. Jenny, next slide. Thank you. So, 5 years ago in a national safe housing needs assessment, we learned that a relatively small amount of organizations used co-location models to increase survivors' access to housing, but all those who did reported that the co-location practice greatly assisted survivors' access to housing. And since then, we are seeing more of these partnerships emerge, and today NASH and NNEDV are excited to explore further some of these cross-sector co-location models in conversation with our panelists from La Casa de las Madres, which is a domestic violence housing program, and they'll be discussing their partnership with the San Francisco Housing Authority. The YWCA of Greater Portland will be discussing their partnership with the Housing Authority of Portland, and New Opportunities in Connecticut partnership, and New Opportunities is a housing homeless organization, and they'll be discussing their partnership with the Connecticut Coalition Against Domestic Violence's DV Rapid Rehousing Program. Next slide. So this webinar will explore what makes for successful co-location, co-working partnerships, including bridging cultural differences across the fields, addressing confidentiality considerations, and ensuring clear delineation of roles while working on site together. And in particular, how co-location increases access to racial and gender equity, and then addresses the safety needs of survivors and the specific barriers that they face. Next slide. So we'll start with the introductions. I'll provide some context setting around the intersection of domestic violence, homelessness, housing, and race inequity, and including the impact of COVID-19. And then pass it over to my colleague, Debbie, who will facilitate the panel discussion with our fabulous participants. And then create hopefully enough time for Q&A with you all. And please don't hesitate to put your questions in the comment box. We really hope to facilitate a peer-to-peer dialogue, which is really the goal for all of these webinars. Next slide. Great. So before we begin, I want to talk a little bit about the intersection of domestic violence and sexual assault, homelessness, housing, race inequity, and the impact of COVID-19. In order to set the context for discussing the potential for how these co-location, co-working partnerships can help address race and gender inequity within the systems that they exist, we need to highlight how DVSA, homelessness, housing, race inequity, and COVID-19 are all connected. This is an infographic that our partners at the National Resource Center on Domestic Violence developed to illustrate these intersections that we'd like to share with you right now.
Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the US general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system, to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it, so we can do more about it together. To learn more, visit safehousingpartnerships.org.
So the disparate impact of COVID-19 on communities of color is not surprising given all that we know about the linkages that was just reflected in the infographic between access to stable housing, safety, and wellness. Next slide. And due to historical racial discrimination and redlining in housing policies, poor communities of color live in disproportionately segregated neighborhoods with less investments in food and medical resources. And this is particularly isolating for people of color living in rural communities. And now I'm going to pass this over to Debbie Fox, who will facilitate a discussion highlighting the co-location models as an innovative example to outmaneuver these systemic barriers that we just discussed that prevent survivors, and in particular survivors of color, from accessing safe housing.
Thank you, Suzanne. Hello, everybody. I'm Debbie Fox with the National Network to End Domestic Violence. And it's so great to be with you all today. There's been some familiar names in the chat box, and so glad you're joining us. And we have a great panel today with a wealth of experience and just a lot of innovation that's happening within their programs and with the other organizations that they're partnering with. So I'm going to do quick introductions to let you know who's here today on our panel. And then we'll get into the Q&A, and they'll tell you more about themselves and the work that they are doing in their community and in their state. So we have Beatrice Vasquez, who is the Community Programs Manager at Casa de las Madres, and she oversees all of the programs at La Casa and has built partnerships in San Francisco, such as with various organizations, not just with their housing authority, but they partner with the San Francisco Housing Authority, CalWorks, the San Francisco Unified School District, the General Hospital, and the San Francisco Police Department, the Housing First Subsidy Program, and 2 single-room occupancy sites. They oversee the Verona Hotel and the Mary Elizabeth Inn. And Beatrice has been at La Casa for over a year and a half. So we also on our panel have Jaidra Hennessey, and she is the Director of Domestic and Sexual Violence Programs at the YWCA of Greater Portland. She has over 15 years of experience working at the intersection of domestic violence and homelessness. And her experience is working with survivors, and that includes case management, shelter and community-based advocacy, sexual assault, hospital response, community education outreach, program administration, and has an expertise and passion for housing rights and protections for survivors. And of course, last but not least, we have Anthony Roldan out of Connecticut, and he is the DVDOC housing coordinator for the Northwest area of Connecticut with New Opportunities. Part of his work is engaging landlords in federally funded housing programs. He provides case management to clients, including budgeting, credit, and background checks in order for clients to know their rights. Anthony was born into this field and says it comes naturally as he's been doing case management for over 15 years and advocates for mentally challenged individuals, those who are undocumented, ex-offenders, and domestic violence victims. So we have some time here to begin our discussion, but before we begin, is there anything else you all want to add to all the great work that you're doing in your communities?
It is 10:58 and
all right, so we'll go ahead and begin our panel discussion then. All right, so this is a broad first question we have for the panel is just if you all could tell everyone on the webinar today, can you give a description of your work, your co-working project, and how it creates housing access for survivors, and in particular survivors of color that are most impacted by the current COVID-19 pandemic, housing discrimination, and evictions. So whoever wants to go first.
Hi, good afternoon. Well, good morning, everyone. My name is Anthony Roldan. I'm a housing coordinator. So here in New Opportunities, we have engaged many landlords, which have been helping the program just house individuals almost within the 30 days, which is the goal from the program. And as well as this is a community service agency. So I've been connecting the clients to one of our biggest program, which is the energy assistance program, which will help clients pay for their utilities. More for however they heat in the winter time.
Good morning, everyone. So through our project, the Safe Housing Project, which we partner with the San Francisco Housing Authority, La Casa works directly with those living in local subsidized housing. We provide support around safety planning, information about legal protections, and other services that help survivors sustain and prioritize safety during their housing. We also educate not only the staff at the Housing Authority, but also the partnering community sites to make sure that survivors are able to ask questions and get resources that they need throughout our program to make sure that they are sustaining and maintaining safe housing.
Hi. At the YWCA, our programs entirely focus on housing. In 2013, we closed our emergency shelter and shifted all of our programming to systems navigation and shelter diversion. So we have partnerships with co-located advocates at Home Forward, which was the Housing Authority of Portland, as well as the Gateway Center, which is a family resource center. We have partnerships with a number of homeless providers on an interdisciplinary team that works with people to prioritize women, people of color, and trans folks that are living on the streets. as well as having some single room occupancy shared housing opportunities as well that are low barrier. So we do a lot of focus on that. Throughout the pandemic, we've shifted to a remote response model to keep people housed, provide rental support, work with our homelessness and domestic violence continuums in the Portland area and Multnomah County to distribute COVID relief to get people caught up on rent who lost income with a priority as best we can under fair housing laws to promote equity and housing stability for people of color. So we've increased that and been doing a number of different services, providing direct assistance in systems navigation with the specialization with the Home Forward or Housing Authority partnership does rental support, relocation assistance, training for Housing Authority staff, as well as community landlords and partners. We do instruction in a program called Rent Well, which is a statewide program that provides rental mitigation funds to landlords who rent to survivors or other people in the community who have barriers to housing that have completed the program. So we manage a number of different funds to help people stay housed, and with a particular focus in this project with making sure that people are not losing their subsidies. So helping people understand their rights, as well as sometimes being, the best friend and at the same time the worst enemy is the Housing Authority staff when we're kind of stepping in and saying like, hey, maybe that isn't the best way to go about that, and that's not super correct, or maybe violating VAWA. So we spend a lot of time in partnership trying to build those connections and that rapport to help more smoothly navigate through that system when someone's experiencing abuse.
Thank you all for those great overviews. It just sounds so much the work that you're doing is providing a holistic response, that you have to navigate a bunch of different areas and systems to really keep survivors safely housed, and look at all the different ways that the economy and COVID and housing discrimination and different barriers impact them, and that you're just very creative in providing those responses. So I know you mentioned, Jaidra, a little bit about working with the PHA and having those conversations around VAWA housing rights, and I think it's particular right now during COVID, and there's a national eviction moratorium. We also have state and local protections as well. But if you and Beatrice could talk a little bit more about how navigating the housing authorities can be definitely a challenge for anyone, but even more so for survivors who are often do not have the information or do not know about the housing protections under VAWA that are afforded to them. So PHA staff are often sometimes unaware, unsure how to implement these protections in practice. Can you share how being co-located and working directly with your housing authority has helped educate survivors and the housing authority staff about VAWA and some of the outcomes that you've achieved as a result of your work? I guess the goal ultimately is for people to keep their vouchers or their subsidies, but if you could talk a little bit more about your work with housing authorities, that would be great.
Sure. So us being at the Housing Authority here at San Francisco, we were very fortunate to have a space available where we did not have to close down during COVID. We've actually still been on site and able to have clients access our services directly at the facility. However, we did adjust to, clearly the pandemic raises concerns to some people, and we offer the service also over the phone. So it also allowed us to, not only for our clients, but for our staff to maintain social distancing and proper protocols. So being able to be there on site has definitely helped La Casa with our survivors being able to not only access the service right then and there when they're in the facility and have concerns and not sure how to go forward with the situation. We've been able to connect them with legal resources. We've been able to help them submit the VAWAs and paperwork requesting transfer. We've been able to advocate on their behalf if a location that's selected may not be safe due to the safety plan that we have in place for them. It's allowed us to really educate not just the staff, but also our clients on what the process and steps to take for the future. We're definitely about self-empowerment. So it's allowed us to teach our clients how to navigate the system within the housing authority and understand their rights, while still providing advocacy and speaking up on their behalf and supporting them through that process. So our program, being able on site, has definitely allowed us to do a lot more than we normally would if we were not on site.
Yeah, we've had some different shifts over the years. I think when we first built the partnership, we were, it was right while we were closing shelter, and you know, the housing authority was looking to partner with the domestic violence program because they'd been receiving community feedback that people were entering shelter or experiencing domestic violence and losing their housing. So they were getting negative feedback from the community, as well as from domestic violence providers and other housing providers who sort of weren't quite clear how to handle this, you know, almost a decade ago. So we partnered with them to kind of provide that expertise and lift that burden off of the housing authority staff who have complex jobs to navigate already, not adding in domestic violence advocacy as well. So as I said, we do a lot of community education, both for survivors as well as for housing authority staff. All the housing authority staff, including, you know, folks working in Section 8, property managers or resident services coordinators in public housing facilities, and different buildings as subsidy types have shifted over the years, can refer directly to our advocates. People can directly self-refer, community-based advocates and other agency providers, whether from domestic violence agencies, homeless organizations. You know, we don't get too many referrals directly from landlords who are, or property managers renting to Section 8 folks, but they're welcome to as well. Community mental health, the police, legal aid services, all refer people to us when they're experiencing domestic violence and accessing a housing subsidy through the housing authority. So it's allowed us to work with people directly to educate them, as well as other folks in the community as well, to, you know, broaden the knowledge base of those protections, which, you know, I think is really fantastic. When I got into this work, I learned about it because I was working in another community where no one in the world of domestic violence housing or housing authorities seem to know about VAWA protections. So really expanding that, letting people know what their protections are, and then that also building trust with the housing authority staff, that we're not here to just kind of throw all the rules out the window, which I think was the fear when we first started working together, that we were just going to say like, oh, this person experienced domestic violence, you know, 25 years ago. So if they burn their house down, you can't do anything about it. We're like, no, you know, people should be held accountable. People should be empowered to make good decisions, but they also make bad decisions. So we've built that trust. And over the years, it's also helped develop policy with the housing authority, where we've been able to increase transfer opportunities, for instance, for people in project-based vouchers who don't have any mobility with their voucher when they're unsafe. Before it was required to have transfer policies, we were able to partner to develop partnerships to move people in based on our recommendations and some criteria around the abuse they were experiencing and safety concerns, to move into a housing choice voucher, or it's commonly called like a Section 8 voucher, so they'd have more mobility. Over the years, as properties have converted from one type of subsidy to another, we've been able to negotiate to broaden the amount of properties and to work with particularly those project-based voucher holding properties and management companies and the housing authority and building owners to kind of all partner to find smoother transitions and expedite transfer processes, when previously it would sort of be like, well, we don't really have any options, we can't do that. So it's allowed us to kind of figure out how to find more options for people, which has just been great and helped a lot of people stay in housing. We also do things like go to, you know, we spend a lot of time contextualizing the experience that people are going through as to why it's not just, you know, someone damaging property, or why there's not control over the situation, or why someone may be still having issues if there's a restraining order, or explaining, you know, the nuances of policy. Even when people are trying to be helpful, that it can sort of be reductive and have ideas that are well-intentioned but harmful to the survivors. So being able to stand in that space with them, whether it's when they're first having an issue, whether it's when they're about to be evicted or lose their subsidy, and then we get connected and we're able to go and advocate for them at hearings or things, or provide that information, or bring in legal aid or other legal advocacy services to help represent them, to keep them in housing, as well as just having flexible funding to be able to say, like, yes, there were damages that you don't have to pay due to DV, but also, you know, you have a landlord who's really upset that, like, you're not paying, you don't have the money to pay that, have the locks changed. We can just pay that for you. So I think and as that spread through the community, it's really increased the number of people who participated. When we had a shelter, we were serving about 65 households per year. And now just in the Home Forward program in the last year, we've served about 125 heads of household. So it's really increased it. And as word spreads, we get a lot of referral from, you know, neighbors or friends or partners or different people, or people who've said, like, you know, I was in an abusive relationship for 10 years. You helped me get out of it. I started dating someone a year ago. Now it's going south. Can you help me? And I'm not sure about my housing being safe. So we'll help people safety plan, as well as determine if they need to move and identify those resources, or provide assistance to relocate.
Thank you so much, Jaidra. And Beatrice, I just was hoping, Beatrice, you could talk a little bit more about your emergency transfer process too, as well. I know you both mentioned that and talked about a little bit about it, but just if you could just tell us a little bit more. I don't know if everyone on the webinar knows what the VAWA housing right is and what the VAWA emergency transfer process is. So Beatrice, I don't know if you can tell us a little bit more about what's happening in San Francisco.
So in San Francisco, pretty much, you know, depending on the housing sites that are available, clients have the right to request, based on the VAWA regulations, requesting a safe housing and location. So transfers can be requested based on the situation. So people can provide, you know, police reports, self-declaration of domestic violence, meaning they can request to be move from one site to another. Here in San Francisco, being that we have a lot of different locations and sites, sometimes transfers are available within different communities. Sometimes it does require them to move to a different community or outside of the city, or transferring their vouchers. It really just depends on the situation, the severity of the domestic violence that's happening in the household. Our agency works with clients to determine what the best safe option would be for them and submit requests to the Housing Authority. Ultimately, Housing Authority does review the situation and figures out the best option for our clients and how to move forward and what safety looks like for them. We work with property sites as well to ensure what that safe transfer process would look like for our client. In San Francisco, not all sites have a transfer process, so it's us trying to work with them on figuring out what that would look like and if it's an option for them. So a lot of the work around the transfers really just comes down to the safety planning and the process and where they're located in the overall situation. Ultimately, we do offer options as shelter prior to figuring out where they're going to go next, to make sure that they're not just going to be moved from one unit in the same building to another unit in the same building. So ideally, we try to identify what would be the best solution for them.
Awesome. Thank you for more detail on that.
Yeah.
I have one more question for you, Beatrice and Jaidra, before we get to you, Anthony. So thank you for your patience on the panel. So the other question I have for you all is, in last week's webinar, there was a lot of talk about the different cultural differences between agencies, the DV, SV, domestic and sexual violence advocacy world, and other disciplines or systems that can make working together a bit challenging. Just a little bit more conversation. Have you found this true in your work? And then if so, how have you navigated these different cultural differences working with the housing authorities? And if there's any specific examples you can offer, and then how has being embedded in those agencies helped shift those cultural understandings, especially for around the gender and race equity pieces, and understanding the dynamics of domestic and sexual violence? That's a lot. So if you want me to just ask you one question, how have you navigated the difference, the cultural differences, and if you have any examples? Sorry, that was a mouthful.
You know, I think I touched on it a little bit about, like, the fears when the partnership first started. I came in to the agency and into the home forward advocate role about a year into the project, and there was still a lot of fear and a lot of just I think concern that we were just there to disrupt things, which in many ways we were. And I'm very honest with people when we do trainings for all of the staff. So not just people working directly with people, everyone from C-suite level executives to maintenance staff. We train on domestic violence 101 and dynamics to help them understand, frustrations that they have. And also, I always encourage staff to understand that they're coming from a different perspective. If you're a property manager and you have someone who's, always causing issues or having problems, understanding why that is, understanding why it's beyond their control often, or even things around lease violations that seem like they would be unrelated to abuse. But once you kind of expand that for them and helping them sort of understand how broad abuse can be and how things that wouldn't necessarily make sense to them are part of that and are connected to the abuse, especially when you get into financial abuse. I often explain in trainings that when on the rare occasion I would work as a navigator for a day at our family justice center, almost every person I saw would name one of their lists of like, I'm going to lose my housing because I live in subsidized housing and my abuser is going to call and say I live there. And so I'm going to get in trouble. So being able to explain that and also say like, no, here's the paperwork you need to do, coaching people or consulting, because then it actually, once we got to a certain point of navigating that and building those kind of friendships and partnerships and trust, then sometimes it would almost be the opposite of like, hey, there's this issue going on. I think it's really problematic. Am I allowed to say anything or am I allowed to do something? And there, it got to this point where sometimes we were like, yes, that person may need to be evicted, or no, someone cannot, their abuser cannot threaten everyone every day and like you can take action. So, we built that relationship where we could trust each other. And then interestingly enough, for a while, our staff got moved into an office because of space issues where they were sort of isolated from everyone else. And it really deteriorated that relationship because we weren't having that peer-to-peer relationship. It was sort of, everyone's like, what's happening? And I was like, well, you sort of built like a war room where everyone's just, stuck together. No one's talking to them. No one's interacting with them. There's no friendship or camaraderie. There's no equal footing. They kind of feel like they can't leave instead of like wandering around and going to lunch with people or whatnot. So building that and understanding the different perspectives that we come from and the different work that we're trying to accomplish, but that the goals should be the same at the end of the day. And reminding people also that when we're asking for things, it's generally not because, as much as it's because we think it's right morally and ethically, it's also the law and therefore something that they're obligated to do. It's not us asking for favors by saying like, hey, can you transfer someone? Because we get a lot of that, like, well, and since, the final rule came out a few years ago on VAWA and emergency transfers, I think that's improved quite a bit, but we still get people who are like, oh, well, that doesn't apply to us. That's everyone else. And educating people with a reminder too, it's great to hear it from advocates before, you'd much rather hear it from myself or my staff than you would from a judge or an attorney or when a lawsuit happens. So like, even when it feels like we're on the opposite side, we're still your friends and we're still supporting you by giving you that feedback and just trying to continue to have that relationship and connection.
Yeah, she pretty much said a lot of a lot of things that we would typically work the same way. For us, really, we just focus a lot on definitely training the teams that we work with and have the partnership built with, on them understanding where our survivors are coming from, the differences, whether it be, the types of abuse, what somebody's view of something is versus their own, and just really understanding we're not asking for favors, we're asking for their rights, but also understanding why someone is in these situations to make sure that people are not just being turned away and judged based on something they're experiencing, and understanding that some people are not in control of these situations, and really just understanding that culture, backgrounds, situations, the length of DV, all these things matter into how someone responds in these situations. And that's what we're here for, as advocates. So a lot of times making ourselves available as well, if they're not sure on how to handle a situation, to be there for them and help them walk and navigate through the process of their own side of the system, to help someone get through the process. And I think with building those relationships and being able to do that, we've been able to successfully educate, the staff and clients together, and working for better outcomes.
Thank you so much. Yeah, there's a little note in the chat box, but I think the recap for that is like, we're not asking for favors. That's like the quote so far, is we're not asking for favors, we're asking for their rights. So yeah, this is, part of working together to make this happen, and working in partnership is definitely required. But it is the law. So then how can we make this a reality on the ground and implement it on the ground? So that's an excellent takeaway. So we're going to shift a little bit now and move away about talking about PHAs specifically, and shift to talk to Anthony about his work and experience in the housing and homelessness context. So Anthony, if you could tell a little bit more about your work. The other panelists did a lot of work in building partnerships with their housing authorities. You're doing a lot in the context as a housing provider, working with domestic and sexual violence organizations. So you're a more traditional homeless organization is what I gather. So tell me a little bit more, what are some of the strengths and challenges to the collaboration of working across systems, and have any aspects of the collaboration surprised you, or what have you learned in that process?
Sounds good. I'm actually learning at the moment. That's great information. Thank you for that. And my biggest.
Oh, we just lost you for a second. You went on mute, Anthony. All right, you're back.
That never heard of the Bible document. I will have to explain that to them as well. The biggest challenge has been is just confidentiality. You're sending documents back and forward. That has been really, really hard. Other things is the challenges that come behind domestic violence. Most of the time, the abuser was in charge of their money. Bills were not paid, rent was not paid. That got them into a whole eviction, bankrupt, all this scenario where we cannot just go tell the landlord that it was due to the past experience that they had. We're just trying to get to the landlord to give them an opportunity, and letting them know that we are here for them. If they are unsure of a situation where they think that they're violating the lease, and it doesn't have to be with domestic violence, then I always tell them to come to me. And I think that part has been big into the landlord part. It's just letting them know that they have a backup plan. You're risking renting to this person that has an eviction, that has bad credit, but you have a program and a support system that is going to be there for them. The great thing about it is having the housing coordinator like me allows the domestic violence advocates and to just focus on finding them a goal plan, finding the next step, building that relationship so they can become success once we house them into permanent housing. That has been really, really, really big. Just the timing of them being in the shelter and moving to their permanent housing. What has been really surprising to me, it's how well the collaboration has been going, because at first I was a little afraid of going into the project due that it was, completely new. I had to deal with vulnerable clients who I didn't know if they were able to trust me or not, but building that relationship with the domestic violence advocates has been really successful, and it has built great, the clients can trust me because of the relationship I built with the domestic violence advocates.
Excellent. So can you talk a little bit more too about what the role, there's some state DV coalitions on this call so far, but not everybody's familiar with the State Domestic Violence Coalition, but can you talk about your your work and your role working with the State Domestic Violence Coalition and the local victim service providers with your organization, kind of like how that all came together?
So it was the Connecticut Coalition to End Homelessness combined with the domestic violence, and that's when they created the Connecticut Coalition Against Domestic Violence. The state provides leadership, and then the local advocates, we just focus on getting the person housed. It's like a brand new to me. It's brand new to everybody in the state, but the whole collaboration has been really great, where they focus on so the state does the funding part, I do the housing, and the advocates, they do the paperwork to submit to request for payment. So it's 3 people working on 1 client, which is pretty neat.
Awesome.
I don't know if that.
And
yeah.
how long has the project been going?
So I know that it started in 2000. I know that everything started in 2017. It launched I believe in 2017, but like completely launched, it was 2020, where they get the housing coordinators. Before, it was just the domestic violence advocate and the case managers doing all the work. And 2020, that's when they decided to get a housing coordinator, and then that way they can focus on the goal plans, and I can focus on finding them housing.
Awesome. Yeah, it sounds like it must be the HUD continuum of care, the domestic violence bonus funds. Yeah. So can you talk a little bit more about any cultural issues as well? I know you mentioned the confidentiality sometimes raises a challenge in building trust with the survivors while you're working with the victim advocates, but anything that you've had to adjust to your work or your approach working with domestic and sexual violence advocates, and have you changed any policies within your homelessness system as a result of the partnering with the domestic violence agencies?
I believe the biggest change that we have done in our agency, it's getting the client's information to be completely confidential. So it's, for example, if I refer them to the energy program, I have to kind of educate my coworkers that now this person, in order to enter into their system, they have to be using codes, which is not their name, social security, or birth, date of birth cannot be included into their application. With the whole, I think the biggest part is landlords asking why is it that the program is assisting this client. So that has been a challenge, where we don't want to go out there and tell the landlord everything that the client has been going through. But that part has been the biggest part, where we really been working on getting that done. It's really hard. It's really hard to have the landlord just trust the program, and it's only a 1-year program. I start asking what's going to happen after the 1-year program. I kind of explain that they have case management, where they're going to build budgeting, they're going to find them employment, they're going to make sure that they have a budget where they can continue to pay for the rent, as well as I refer them to the energy program, which the energy assistant will pay for the utilities.
Excellent. Thank you for all that information, Anthony. And then, we have another question. We'll open it up for everybody to discuss. We could do more popcorn style, but I know we've all talked about this a little bit here and there, but and Anthony, you mentioned there was, you've done a lot of work around this, but how have you ensured adherence to confidentiality requirements without shutting down any spirit of information exchange and having open dialogue? Because often there's that feeling of like, if you're not sharing, you're not engaging in the partnership. So how do you communicate about those confidentiality requirements and help your partners understand it?
The whole part has been so me educating the system. It's brand new. I've had to learn as well. I had to ask other people that have been here in the agency way before. With the landlords, that part we have to share their information, because of the lease and the background check and all that stuff. But for example, if we send them any letters to their house for either requiring documents, signing documents, or anything like that, their name will not be in the posted there. It's just going to be the address of the client. Same thing with energy. When we call to connect their energy services into the apartment that they're moving into, we ask them to have this client completely idle, so they cannot share no information whatsoever. I believe that, like Beatrice said, this is their right. So once we kind of tell them that this is their right, we're not asking for nothing special from them, they completely understand and they go with the flow.
Jaidra or Beatrice, anything for?
I can go ahead and add to that. So with our partnership, La Casa in general has, we definitely have our staff very educated on our confidentiality policy. So we have a rule of we communicate via fax, in person, or over the phone. We don't send any communication via email. So one of the things we definitely do with the partnership is we send releases of information that are very specific to what we are going to be sharing and with whom. It's not just general to housing authority, it's specifically to the worker that's working with them, and for the sole purpose of making sure that they are able to maintain their housing and helping with the transfers. It's just very specific to what we're going to be working with someone, and making sure that we have weekly check-ins with the workers at housing authority when we do have transfers or any VAWA submitted, any request in place. To make sure that we're in person handling what the process is and the next steps are without oversharing information, to make sure that our survivors still have confidentiality, but are also getting the service that they deserve.
Awesome. And I guess that also raises another question for me. I'm going off script now, but how often are you meeting as partners? Is it weekly or monthly? How much is their planning, and how it sounded like Jaidra, you mentioned people are like sharing offices perhaps, but how often do you meet to keep the partnership going and connected?
We have a monthly partnership check-in with our partnership. So our advocates, the program supervisor, sometimes I pop in, and then a representative from each department of the housing authority, or a person from the kind of public housing side, a person from the rent assistance, like Section 8 side, that would be the voucher programs. And so there's different people coming to the table, and then someone from resident services that are kind of the social workers based at properties. So there's a representative from each person that kind of brings and represents their interests. And then we also meet with workers as needed. So there's constant communication there. Also, working, like I said, doing trainings. We do trainings at least quarterly. So, and then as things arise, or different people will step in to handle different things. And then usually once a year or so, we'll have a broader policy meeting with agency leadership to discuss policies or things as they arise or need to be changed.
Yeah, it's very similar for us. The on-site staff who's there at the housing authority for us is actually meeting with the director once a week to discuss any pending cases or any pending situations or requests. We do have a more collaborative meeting with other partnerships and people who collaborate with us in this program about quarterly. We also do trainings on a quarterly basis just to make sure that if any new staff that comes in is also trained properly. Our staff being on site, they do a lot of outreach. So they go around not only within the community and the property sites to provide information, but they're also doing it on site, making sure that all the staff are there, know where they are and how they can help and how they can take over and help during like an intake. So it's we're meeting with them on a consistent basis just to continue the partnership and just making sure that there's open lines of communication, and we support each other, not just when we need something, but also if they need support and understanding something too.
Anthony, are you, it sounds like you all are meeting regularly as well, just.
Yeah, well, we have bi-weekly meetings, and then we have quarterly trainings as well. So, and with the DV advocates, it's every day mostly.
Yeah, so this is very helpful. Yeah, for this to be successful, it sounds like communication is critical, it's very key. Yeah, so another question that next one is we're going to talk about any changes. I know we touched on this a little bit, but in particular, have you seen any system changes or policies or even beliefs and how survivors are approached as a result of this work? And then have you seen increased access or in the housing authority model, survivors keeping access to their resources and their subsidies, especially communities of color most impacted by COVID and housing disparities?
I don't know that we've definitely seen an increase in referrals and a decrease in people losing their vouchers or housing or their subsidies due to abuse that they're experiencing or VAWA covered activities. We've also seen, I don't know, I would credit this partnership with it, but the success of our coordinated access systems. We have 4 in Multnomah County where Portland's located, and one of them being a domestic and sexual violence one. And we were early adopters of a coordinated access system and new tools. So because that implementation has been so successful, as much as, both I think my staff get frustrated with the housing authority staff and vice versa, and our advocates get frustrated with the coordinated access system, we have seen it open up more housing opportunities in the community. So we've had new vouchers come through and set-asides for survivors that come through that system. So we've seen expanded access as well as increased retention of housing. Particularly, and we serve in that program, we serve about 85% of people are from communities of color or biracial or multiracial. So it's predominantly reaching communities of color. And luckily we've seen some of those folks least impacted by COVID because of the ongoing housing subsidy. And we've also had not only the national, but local and statewide eviction moratoriums as well. So usually we can step in if there's a concern and help explain why it's, especially unpaid rent is not the concern that the property manager may think it is. But also, as I said, we've been working with our continuum to roll out significant amounts of rental assistance as well, not just for domestic violence with our flexible assistance that we have all of the time, but with COVID specific assistance as well. So it's really helped reassure a lot of those property managers and landlords that they're not going to just be moving people in and losing money, at least due to COVID or abuse.
Yeah, I can add to that. On our end, we've definitely worked more on resourcing to making sure that people have access to, getting deposits, rent assistance, anything related to making sure they continue to obtain that voucher and that public housing that's available to them. A lot of things is us calling on a daily basis, other resources, agencies, figuring out what they have available right now here in San Francisco. Resources are very tight here right now, but we still managed to locate what agencies are available for clients and helping them submit paperwork and anything they can possibly qualify for to help them maintain their housing. With back rent, one of the biggest requests right now. People afraid that they're going to lose their housing due to unpaid rent and domestic violence also increasing within the communities and their households. So right now we focus a lot on encouraging them to deal and support them with the trauma that they're experiencing, but also making sure they don't have an additional stressor worrying about how they're going to pay that next rent or utility, and communicating with landlords and advocating for them on their behalf.
And in Connecticut, I know that you mentioned, Anthony, your project is newer, so there's those new resources, but any other increased access to resources and communities most impacted by COVID?
Well, new opportunities. We are connected with the state agencies, and we have a broad of programs in this agency. So what I usually do in order to engage landlords, I talk to them about all the different programs that we have. I actually start with asking them if they have any tenant that hasn't been able to pay their rent because of COVID-19. And then there I refer them to the resources that we have. So right now in Connecticut, we have the Unite CT, which can assist tenants pay for their rent up to $8,000. There is the homeless prevention program, which it's almost the same thing. It's to avoid people, losing home. And then we have the 4CT card, which is run here, New Opportunities. And for that one, it's only $900. It's actually, just in case you lost, say you were affected by COVID and you couldn't work for a whole month. So usually the rent is around 900. If not, then at least it's more than 70% of your rent. And sharing those programs with landlords and letting them know that we do care, have all those resources, makes a huge difference. They feel secure. They feel like they have somebody to come.
I also feel like I should add in terms of expanded resources, probably the most important one. We, because of the success of the program and the increased numbers we've served, we started, when I came into the program, each advocate had $1,000 a month to provide client assistance for rental payments, deposits, things like that. As we've entered into a housing crisis through those years, our costs have increased. So we've gone from spending about $24,000 a year to about $150 on client assistance. And that's been able to be increased due to funding through our county and state, through the Joint Office on Homeless Services in Multnomah County, the Domestic and Sexual Violence Coordination Office, that provides us some sexual assault funding to work with that population specifically, as well as other program expansion and funding, as well as funding through Ywca and VAWA at the state that we use for staffing purposes as well. And so it's actually, the more successful the program is, the more it increases, and then the more the value is seen, and the more we've seen that increase as well, especially I think as other folks are like, oh, can you give them more to do this so we don't have to? Like the county has taken over some emergency transfers outside of the housing authority. And I think as that has developed over time, since we do that within the housing authority, we've discussed, potential expansion to be able to provide that to all survivors, not just those in Home Forward or Housing Authority of Portland portfolios as well, just for consistency and ease, since we hold that expertise.
Super helpful. And it's just, it's great to hear that the federal resources that are happening and being talked about here, that they're getting to folks. Obviously there's always need for more and expansion, as you're describing, but yeah, it's good to hear about the state and local investments as well, to kind of balance things out and fill things out when there's additional needs in communities. So could you all talk a little bit more? I know you've talked about different expansions and changes you've made around your projects during the pandemic, but how was co-working, or how has your project changed during the pandemic specifically?
For us, our program, being that we're still on site and we were able to maintain our site open, a lot didn't change other than the fact that the community was feeling unsafe and did not want to reach out for services, didn't feel it was safe to do so. So shifting from in-person made it a little challenging with their confidentiality paperwork and process, as we are now offering services over the phone. So having to collaborate with the agency, housing authority, figure out what documentation, how we can word it to make sure we're still getting approved documentation and paperwork submitted, with making the accommodation of people not feeling safe to come into the office. So that was a little challenging. However, we were able to manage and figure out the right verbiage of, due to the pandemic and, client not safe to come in. We were able to make accommodations and have things still submitted on time. But definitely just shifting from phone when all of our services are more in person was a little bit of a challenge, but we have managed to offer via Zoom or, just a phone call to make sure that people are still getting their peer counseling. If there's new issues that they need to report, that, we're being notified on time. Pretty much is what we changed in that program.
Yeah, we've mostly maintained services in the same ways, except moving to a telehealth platform for video chats or phone calls, and doing extremely limited in-person things if someone has technology barriers to be able to complete paperwork. Both our agency and the housing authority converted documents to online fillable forms so we can help people. Oftentimes our staff kind of step into that role and help people complete their forms that they need to do with the housing authority as well, so they can access that easily online. And I think at the beginning, one of the biggest impacts we've seen was that at the very beginning of the pandemic, when everything was shut down, we weren't getting very many referrals. And that was concerning because we were hearing from the rest of our community partners that domestic violence rates were going up and we weren't getting calls. And then as soon as people kind of got comfortable and realized they could connect with their housing authority staff, then our referrals just kind of skyrocketed. And so, we've tried to maintain services as much as we can with limited capacity. We only have 2 advocates in that program, and we've seen our referrals almost double. So the need in the community has increased. And then the survivor experience of, having less people moving, so less options. Transfers have slowed down because vacancies aren't happening as much. There was a period there where just filling out an application for a new apartment was really difficult because people hadn't figured out, in property management companies, how to provide services, do tours, things like that, as well as a lot of increased levels of lethality and violence that people are experiencing and being trapped in their home, as well as some pretty negative experiences with law enforcement and, both through the criminal justice system and courts being closed down, but then also the response that they were getting for a while from the police, particularly here in Portland, while we were having a lot of social justice uprisings and protests. The police response for domestic violence really went down. So and then that lack of mobility for housing really greatly impacted survivors. So trying to both advocate with our community partners, our community leadership, with the criminal justice partners that we work with, as well as finding ways to put people into motel vouchers, get people into shelter, and find creative solutions to safety plan with people who weren't able to access safety through the channels they would usually rely on. Was probably the largest impact of COVID that we've seen thus far.
That's a lot of layers to navigate, to work through. Anthony, do you have any other things that have changed or shifted in your project in the last year or so?
So our agency never closed. We were able to have clients coming into the office. The biggest issues was the client not feeling safe to coming into our office. So a lot of the documents that we needed to sign in order to keep confidentiality was me having to drive and meet with the DV counselors in order for the DV counselor to go into the shelter, since it was mostly female shelter. I wasn't allowed to go into the shelter, so they had to go there, get the document signed, and then they would have to meet again, and then for me to get the documents in order for me to process whatever the application is for the housing part, or whatever assistance they need.
That's the next level of creativity to get it done. So yeah, that's amazing.
I'm sorry, I was just gonna say we did it. We got it to work, and again, building that relationship has been huge with this collaboration.
So this next question, it doesn't apply since a lot of you have still been doing work in your sites and staying on site, and you've been open for business. So the question is, working off site brings its own kind of stress. What supports do you have in place for advocates or your staff? So I would just think, that is one question, or just even if you are on site and what supports do you have during this time, during the pandemic? And Jaidra mentioned, yeah, the intersection of the racial justice uprisings that are happening. So what supports are in place for advocates during this time?
Here at La Casa, even though our staff is not here at our central location, but they are in different sites, we offer the Employee Assistance Program, which offers them counseling 24/7, 7 days a week, for them and their family members to be able to access and discuss, how they're feeling, how they're being affected by the pandemic and the change in the shift of work. We also offer weekly check-ins with them where they do come into the main office and have a check-in with me individually, just to make sure that mentally they're doing okay. If there's any concerns or time off needs to be approved and encouraged, just to make sure that everybody's still not only able to help the clients but helping themselves as well through the pandemic, as it is stressful and there's a lot of concern and own insecurities and anxieties around the pandemic. So just being more supportive to the staff to ensure that they're still okay and feel safe to do the work that we do.
I think we've, to be honest, I think we've all struggled a bit being apart. Generally, we do weekly check-ins with each advocate and their supervisor. We have an open door policy. I don't supervise those advocates anymore, but they can call me anytime, email me, text me, whatever they need to get support, debrief. Same with their supervisor or any of our leadership staff. As well as in non-pandemic times when we're meeting, we do two, since all of our staff are mobile or co-located, we kind of have a central office where people can stop by, or the Gateway Center. So we see each other in passing occasionally during the pandemic as well. But in non-pandemic times, we do two staffings, one which will be generally based around business updates or, training information we need. And then one is just focused on being together and self-care. I think for a while, our executive director and leadership probably were very concerned about what we were doing, and then realized it's very, I'd say it's a best practice in organizational trauma prevention by just, we'll go to the park and hang out and eat snacks and talk to each other because we don't see each other often. We'll, talk about our lives. We'll go swimming and have a picnic. So we'll do yoga. There's lots of different things that, like I said, I think there are points in time where people were sort of like, why are you doing this on work time? And we're like, because we need to be together. We need to have that community. We're all people. We're not just advocates. And the same with the pandemic, acknowledging that this is really hard to even exist as a human, let alone as a caretaker and an advocate and a person who has to stand in these spaces when there's multiple levels of community-wide trauma going on, both in our own lives and in our professional lives. So being able to reconcile that and say, it's okay if you're not doing that great. Or at the beginning, people kept confessing to me, like, I feel like I'm only functioning at 75% or 50% today. I'm like, that's okay. Yes, we want to serve survivors and help them, but also we have to take care of ourselves as well. And so allowing people that space to be real people and be humans and say, like, I'm struggling today, I'm having a bad day, and offering them support and, holding that space when they're like, I don't know what I need, or I just, need to go home early or take tomorrow off. We're very flexible with our time off because of that. We encourage people, and I think it keeps people engaged in the organization because we have a more almost of like a family relationship than necessarily a strictly boundaried professional one. While we still maintain professionalism and boundaries, when we would have in-person staff meetings, I was always impressed when people leave and are like, okay, I love you all, have a wonderful day. So just always like recognizing that both with the people we work with and the people who work for us, and the people we have to engage with that we see resistance from in community partnerships and things like that are all people at the end of the day, and we all need to get through this together. And so, really, I think that's the best way we can do to stay engaged at this time.
Anthony, any other things that New Opportunities is doing to keep people supported and connected?
As a New Opportunities, we're connected with agencies that do a lot of telephone calling. So if we have any client that states that they having difficulty, going to, coping with the pandemic, we can refer them to these agencies where they can just they don't even have to share their name or anything like that. It's by telephone. You talk to the counselor and you express yourself, and then if they believe that you have if they believe you need more services, then they refer to those services. But it's completely confidential, and they can just say whatever they're going through at the moment, and it hasn't been easy for anybody. So it's good that we have that system.
Thank you all for the reminders that, during this time, we're not superhumans, and the pandemic, while there's more inequities that vary by communities, but we're all impacted, and especially those doing this work, just continuing to dig into our trauma-informed practices that we utilize when working with survivors, also thinking about those being implemented and highlighting those when we're supporting our staff and people working. And especially, if you are working offsite or within another organization, or if you're, a lone homelessness advocate working with DV providers, or a person working in the housing authority that's a DV advocate, just how you can support people in different environments is critical, but even more so now during the pandemic. So I have one more last closing question. We do have some excellent questions in the chat box, so we'll do some Q&A the last 15 minutes or so. But the last official question is, if you were talking, or if a program called you and said, hey, I want to do co-working or co-locating, doing this model, tell us what advice, what's great about it, what's hard about it, what would you advise someone who's going to do a co-working model?
I would say make sure that you're good at communicating. Communication is the key to success. That's for sure.
Awesome. I love that.
I would say be open to trial and error. Nothing is perfect. There's always challenges that come with it, but in the long run, it really is worth it when you're able to help somebody stabilize and keep their housing, and advocate for themselves and educate themselves, even for future situations. Not that we wish for them to remove themselves from a domestic violence situation and go into another, but if they have any other situation happen in the future, that they're well aware of what their rights are and how to navigate the systems.
I agree with both of everything you both just said. Just being creative and open to change, open to others' perspectives of their approach, and understanding that we don't all have the same perspectives and approaches, and that there's always room to change, and that even sometimes when we get really dialed into things, it can seem like more challenging, but you have to look at that macro lens too. Like, we can get really frustrated with our community partners, but then when you contextualize it, and every once in a while, someone will be so mad, and then they'll get a call to do a consultation for someone else, where it's just, they're like, oh, I have such an appreciation now for the people we work with, because they do have this training, they do have this foundation of understanding, and it really helps shift that perspective back to that this is a partnership, even if we're not always on the same page or going after the same priorities, and that holding people in that unconditional positive regard, that we all have difficult jobs and we're doing our best, and not everyone is a trained domestic violence advocate or has their own baggage they bring to things. So being open-minded, and again, holding that humanity with everyone.
All right. These are awesome. I also, these are like good lessons for life. It's not just for this partnership, this working partnership, but these are all like life lessons. So yeah, my takeaway for successful partnerships, co-working partnerships, or communication is key. Being open to learning and making mistakes, be creative and open to change and other people's perspectives, and consider people in unconditional positive regard. So I think we can all agree with those things, can make things work in life. So I love that advice and those recommendations to take with folks as they consider doing co-working projects. We have about 15 minutes. Oh my gosh, we're doing great on time. We're just gonna coast out the last 15 minutes with some additional Q&A from the chat box. So I'm gonna pass it over to Suzanne Marcus, who started us off. So she's gonna ask you all some more questions. So these are like the surprise pop question portion of the webinar. So I'm gonna pass it on, and thank you all for all of your wisdom and sharing your expertise today. So thank you all.
Hi. Yeah, we've been getting some great questions in the chat box based on your fabulous conversation. So really basic, if any of you know, how are your co-location partnerships funded? If you're aware, for folks who are interested in doing something in their own community. And this might not be something you know, but if you do have some insight on whether these are local funds or. Do any of you have any insight on that?
My understanding, the CCDAV, it's funded by the Housing Authority Department. It's like a grant that is given to the rapid rehousing.
Right. Okay. And I believe that's the Connecticut Coalition has the domestic violence rapid rehousing funds through the COC or through HUD. So.
COC and HUD. Yeah,
right.
sorry.
No. Great.
Our positions, our staff are funded through different sources. One is funded through local funds through our Joint Office on Homeless Services, which provides a lot of local funds to us through our county general and city general funds. We also have an advocate who is funded through state, a state pass-through of federal funds, so VOCA and VAWA, as well as a little bit of local funding. That position's kind of a patchwork of different things because they cover different topics. And then, as I mentioned, we're lucky to have a generous amount of resources devoted to housing and the housing crisis and stability in Multnomah County. So a lot of our client assistance, virtually all of our client assistance comes through our county city collaboration of the Joint Office on Homeless Services and then federal resources for COVID assistance.
Thank you. And Beatrice, do you have a sense of how your position is funded?
We have city and federal funding as well as our own private funding, which we fundraise for a lot of our positions.
Okay, great. And Jaidra, that just jogged my memory. I am aware too of some co-location positions that have been funded through VOCA, through some of the CARES Act funds that have been recently made available. You've answered this in some ways, but I thought this was an interesting question that came up in the chat box, which was for folks who, and Jaidra, you in particular did a great job talking about how you try to help keep your staff feeling connected. But is it isolating? And I'm thinking about you, Beatrice and Anthony, out there, sort of away from your home agencies. Do you feel disconnected sometimes from the program that that hired you, and from that staff culture? And if there's anything that your organization does to make you feel like you're still part of that community and culture?
For me, I am stationed at our drop-in center, which is our central location, but all my staff is actually off-site at different city partner locations. So one of the things we do is we definitely, some of the staff, has voice that they feel like they're not always involved in some of the work. But a lot of our programs are very different, so it's really hard to kind of mix the programs in. But what we do is we definitely have everybody at least once a week come into the drop-in center and spend half a day here interacting with the rest of the team that's here. We do rotations, we have staffs meetings, even now via Zoom. I have multiple meetings with all the programs together to make sure they're still building like a team environment weekly, so they can kind of, feed off each other, ask each other for support. Just trying to make sure that they're constantly engaging with the rest of the team is something that I definitely take the time to do with them, so that we all feel like we're still working on the same mission. Even if we're at different sites. A lot of our programs do end up intertwining if they send them to our central location for services. So at some point we are still all interacting, but we have some locations where it's a lot more individual and independent work. So we take a little more time to make sure those folks are coming in ongoing to make sure that they have the support. I mean, my team calls me on a daily basis. I'm always phone or in person. They're always welcome to just drop in, talk to me, ask any questions. So it's not like we just have a set time that they can communicate with me. I'm literally like as small a question as it could be, I'm available. So just making sure that they know we're all here together, and I'm not available just because I'm on meetings or Zoom calls or anything like that. We have chats, email, things like that. So
That's wonderful. And it sounds, Anthony, that reminds me, Anthony, of something you mentioned, that you're in constant, like you're calling in often with your organization, and that's sort of your connection. But is there anything else you would say around the isolation piece? Because I know that that's something that comes up.
We have Zoom meetings every 2 weeks, and in those meetings we kind of case conference our cases, plus we also do intercourse, like the good and news, what's new with you. So I think that both agencies have come together in order for us, so everybody feels as a group. We kind of have it set up really well.
That's great.
I don't feel isolated.
That's great. And it just sounds like Beatrice and Jaidra, you do such a wonderful job building the community amongst your staff, and really staying attuned to their needs for connection and support while they're out in the field. A question we received was about how you talked a lot about how you tried to make the program that you were working with feel comfortable working with you. What about the alternate side? Did they do anything to make it comfortable for you coming in? Was there anything that they did early on in the partnership that felt welcoming or supportive of sort of your new role in working with them in sort of in their space often, particularly with Beatrice and Jaidra, that you would want to highlight?
For us, we did. We've actually, our location here, the Housing Authority site, has gone through some renovations. So throughout the process, they have included us on like what our needs are, making sure that we have the space available to meet confidentiality when we're meeting with people in person. The most recent thing that they've done for us was they've relocated us within the building to be able to provide us not just a meeting space for one-on-ones with clients, but also a community space, so that we can have their children also there if they're afraid to leave them at home. It's a more private space, but located on the same floor as the caseworkers we typically work with. And just always constantly checking in with our teams on like what they can do better, how they can help or how things are going, so that it's an ongoing thing of checking in. Like, do we need anything? How's it going? How can we change it? So it's nice to have that.
Yeah, that sounds wonderful. What about you, Jaidra? Is that similar? Or?
Yeah, at the beginning, I'm not quite sure. Like I said, I came in a year into the project, and my takeaway was sort of the leadership. A lot of folks had gotten comfortable, even those that were apprehensive. I think there was some resistance from what I was told. I remember the person I took the position from saying how they had experience where there was a person who was very unhappy and very against the project. And then through working with them a few times, and then, I don't know if it was a participant that they had or something in their personal life, because we also provide domestic violence services to any housing authority staff as well. So we'll provide that support, safety planning, financial assistance, and whatever they need. So we're a resource for them as well. And at some point, something had happened where this person had either a direct experience or a family member or a person that they, was on their caseload and had a good experience and really, went from being a huge detractor of the project to a huge supporter of it. And so we've seen that happen a lot. And so it's always surprising every once in a while when you have someone who's having a negative experience, or you'll go to a training and, a finance person is like, this is the best training I've ever had ever. Is everyone required to do this? So it depends. People were really welcoming when I got there. Sometimes people are sort of like, who are you? I don't know what's going on. What are you talking about? But for the most part, people were really open. And then as we did those trainings and we rolled that out and kind of people started to understand and see that ultimately our goal is to help them make their job easier, not more difficult. I can't imagine having, a 400 person caseload of doing rent assistance paperwork and then having someone come in and say, I have domestic violence, and feeling like you have to know how to solve that issue or help them in ways that you really aren't comfortable or qualified to do. So saying like, that's what we're here for partnership for. So being able to consult and then just building friendships too. Like I said, we were amongst people and then got moved to a little office, and it really deteriorated things because you weren't going to going away parties or lunches with people or becoming friendly with, I haven't been in that position for 5 years, but I still, get dinner with people that I worked with at the housing authority, or, that's what anytime there's a conflict, I'm like, should we just do a happy hour or a lunch meeting or something where we can just hang out? And again, remember that we're all people. And, sometimes in holding that perspective of not holding grudges, like saying like, on this case, we're going to butt heads, we disagree, we have different perspectives, and then, okay, let's put that away because then we have to move on to this participant that we also have in common and we're on the same side and we both want to help them. So being able to hold that professional boundary of like, this isn't really personal, even if it feels like it, because we're pretty tenacious and feisty and we'll take a stand with survivors for their rights. So just reminding them like, this isn't a personal attack on you. This is like a right is being violated and we want to educate you and we all want to be friends at the end of the day. So.
Just such great strategies. So thank you for raising them, and it's just reminding me how much I miss happy hours. But so we got a really good question. Our last question is really connected to another question. So somebody just posted, particularly with Beatrice and Jaidra, with your housing, with your support being within the Public Housing Authority office, if people see a survivor going to speak with you, how does that protect their confidentiality? Is that a challenge? Do people then automatically know that that person is a survivor, the housing staff? And similarly, there were other questions around confidentiality more broadly. I know we just have a few more minutes, so this might be something we have to follow up with folks through email, but any written agreements or policies that you have in place to protect that confidentiality, that's often something that prevents people from exploring co-location or co-working partnerships because of the confidentiality considerations. It sometimes can feel overwhelming. I know that's a lot in a few minutes, but what are your just sort of immediate reactions to those questions?
So for us specifically, the way the office and locations are set up, it does allow for a little more privacy. So typically when we have a worker who wants to refer someone to us, they would definitely have access to give us a call in our office. They can page us and let us know. So either they can bring the client up to us to our office location where we're located, and it's not right in like a high traffic section of the building. It's a little more isolated. But also just having the client directly call us is one of the ways that we do, so that we can avoid, somebody walking through and other clients seeing each other or other staff. It's having them just kind of connect with us via the phone or having us come down to their office. Typically, we ask that the survivors call us directly so that there's no miscommunications to what the needs are. and then we will initiate the process. But for the most part, it's typically the process they know is they can have them call us directly. They can be in the lobby. One of our staff would come down, buzz the door, they come in. We don't wear badges, so they don't know we're from La Casa. So anybody's safe to assume that we're part of the housing authority when we're there. Even when we go up to the floor that we're located, our office door does not also have a sign. So even if somebody else was in the building and someone walked in through our office location, they wouldn't know who they're meeting with.
Thank you.
Yeah, we're very similar. I mean, our business cards don't say domestic violence or sexual assault or anything indicating. They usually just say advocate or emergency advocate, housing advocate. So that way people can take our business card and not have to worry about paperwork being found. We limit paperwork that we give to people if they are still with their abuser and feel unsafe taking it. A lot of times referrals have come from the housing authority staff where they've disclosed it. They can either do a referral form where the person signs it and says, I want you to provide this information, and has a kind of mini ROI of saying, you know, you can share this, or they can do a warm handoff, or they can just give a phone number or an email address that we have and someone can reach out directly. We're also mobile advocates when we're not only telehealth. So people can reach out and say, hey, I want to talk to you. And we'll say, do you feel comfortable meeting at the housing authority offices? Do you want to meet at our family justice center? Do you want to meet at our offices? Do you want to meet at your home? Is it safe there? You know, I mean, we meet folks in shelters, on the streets. I've done, you know, and explain confidentiality, but met people because they're on their lunch break at Starbucks or at McDonald's or wherever someone feels safe and okay. And we'll say, like, maybe let's not get into all the depth of your experiences if we're sitting in a Starbucks, but if that's where you feel safe, and we let people determine that and tell us what they need and what they want. But we don't identify that. So staff will know, and we do explain that as well in our releases and everything. Like, if you're coming here, someone may know you're experiencing DV. And for the most part, people are like, yeah, I know, I already told them, they told me to talk to you, so it's fine. But we do a lot of, we have an MOU with the agency, and then we do confidentiality. You know, we have high standards for that, as well as the housing authority as well. They have a lot of restrictions on how they can handle any domestic violence related paperwork as well. They can't keep records of it in databases or anything like that either. So they're pretty understanding of that. Although sometimes we have to remind them we can only give the minimal amount of information, and we're not here to kind of gossip and like give like all the details of people's experiences unless they need to know that. You know, and there's times where it's like, oh, this person has a history of causing lockdowns at public buildings, that there's their abuser. And so we're going to give you a heads up that if this person comes in, take it seriously. But usually that's pretty rare. For the most part, we give information on a need to know basis with extensive releases of information.
Well, we are 3 minutes over, and I could probably talk for another hour, particularly around the confidentiality pieces. But I just want to thank you all so much for sharing your partnerships. I want to flip really quickly to a resource slide, just so folks who are interested in getting more resources on this intersection. And if there are other, we have contact information on the slides that we'll be sending out if folks want to reach out to the panelists. I want to thank Debbie for moderating the panel, and our panelists. Thank you so much for your time and for sharing your good work and your strategies and your time. So with that, for participants, please just be on the lookout for a copy of the slide deck and a recording of the webinar. And thank you so much for participating.
Yeah, thank you for having us.
Thank you.
Thank you. Have a good day.
You too. Bye, everyone.
Take care.